Greetings, Madison College friends. This is Kristen Gebhardt from Human Resources, and I'm here to talk to you today about our open enrollment coming up in June for health and dental insurance. As you can see, these changes will be in effect from August 2016 through December of 2017, and I'll talk a little bit more about that in a couple of slides. So for those of you who are newer to the college, we have a benefits committee here that was established back in 2002. And it is something that we have done for benefit plan design, and we've always done that type of thing outside of bargaining. And it's worked really, really well here. We are known as a best practice model in the state, and we actually have kept that process going even post Act 10 just because of how well the whole process works. We are made up of PSRP, faculty, and admin. We work 100% consensus, and we work year-round together, meet about 2 times a month. And we're always looking at current market trends. We're always looking at aggregate data, so we're up to date on what's kind of going on in the benefits field. We also have and have had a support from M3, who is our health insurance consultant, a local firm here in Madison, and they also help us keep up to date on what's going on. So we do have an individual by the name of Jeff Ireland who also attends our meetings. So our mission of the Benefits Committee, again, is we are maintain high quality benefits, which I do believe we've done so far. Try very hard to keep that a reasonable relationship, though, between the quality and the cost. That's why there has been some changes here and there. Normally, we are into steering people towards better quality and lower cost choices. And we model those values of the college, I believe, through the cooperation, communication and consensus, and we're a great team, and I'm very proud to be part of it. We build our stewardship through guidance, education, and we do a lot of problem solving together. So here are the representatives of the committee, and it changes here or there when people either move on, retire, or things like that. We always make sure that we have someone on the faculty who's in the healthcare field, which right now is Sue Kamel from our faculty nursing department. And we also obviously have wellness with Lisa. We also have tried to have someone from one of the regional campuses, which is Sherry Cunningham. She's a new representative. And so we always usually have our budget person as well. So Sylvia's been on the committee since she started. And really just a really nice mix of people. Mark Lausch has been a great addition as well with the background that he has even in public health. So it's a great team. We've got some veterans on there. Cindy's been on a long time. Linda's been on quite a while now. And we've just work really, really well together. So, as I said at the beginning of the slideshow, we have decided to change our enrollment period from June of every year until November of every year. So the changes go into effect January 1st. And a couple reasons why we did that. Open enrollment is better in November. All of our employees are here. The faculty haven't transitioned away for the summer, and I think it's probably better to communicate. And it also syncs with the enrollment for vision and flex spending. I get feedback from people saying, you know, something changed in the health insurance in August, but I can't change my flex spending until January. So we just decided that it would be a smoother thing to do to just kind of to have one open enrollment for everything instead of having 2 throughout the year. So let's look at some changes. Delta Dental, this kind of came out of nowhere to me. We actually had a 9.9% premium increase, capped down to that 10%. We had a lot of claims this year, or this past year. So we've got a fairly significant increase for dental than we normally do in the past, or have had in the past. So also, please keep in mind, for those of you who might have any different conditions, you can qualify for additional free cleanings to care for things like pregnancy, diabetes, heart, kidney treatment, cancer, immune system issues, and periodontal disease. It's always great to have an extra dental cleaning throughout the year to help these things these conditions stay in check and make sure everything's going okay. So make sure that you contact Delta if you've got any of those conditions and add another cleaning to your year, because we all love to go to the dentist, right? So then let's look at our healthcare. How can you keep your costs down when going to the doctor? So there are many things that are considered preventive care, and that's through the Affordable Care Act has designated some of those things. So a lot of annual physicals, anything else that a clinic designates as preventive care, you're not going to see a copay or coinsurance or anything like that for that appointment. Now, if you have an additional charge such as a test or labs or anything else, referral, not coded as preventive care, then you will have cost sharing in that part of it. Also, Truax GHC Clinic, we've been around now almost 3 years, and there's still a lot of people that don't realize that WPS members can also use this clinic. So GHC and WPS put together a special agreement for lower costs for some of these things, labs and preventive care visits or annual exams. So please take advantage of that. It helps your pocketbook, and it helps the college as well. So there's all sorts of cool things that the clinic does. So hopefully you'll give it a try. Also, both plans, both GHC and WPS, have virtual appointments. So if you're traveling or it's in the middle of the night and you have a sick child or you're sick, you can try out Virtual via GHC and Teledoc through WPS. And both are super cool. Like Teledoc, you can actually look at somebody on your phone or your iPad or your laptop and actually be talking to a doctor. And so that's something to definitely keep in mind if you have students, college students away, things like that. So just make sure you check that out because it's a pretty cool service. So what did impact our rates this year? Like I said earlier, a lot of dental claims, which is fine because we want good teeth. Federal fees, the Affordable Care Act definitely has added expense to our plans and added again to the increase this year. And then specialty drugs are very, very expensive, but also very, very needed for the people who are using them. But it is something that does affect the rates. This year's changes aren't a lot. However, you will see our extended enrollment period. So the rates that we have are locked in for 17 months. So the next time we have an open enrollment that includes health and dental will be in the latter end of 2017. So those rates are locked in for 17 months. GHC went up about 5.2%, WPS went up 5.6%. Delta, again, went up 9.9, as I said before. The only change, really, in the plan design we made are the copay on primary care office visits are, for both plans, are $25. The GHC copay on specialty care also went to $25. And GHC, there is an additional copay on advanced radiology of another $50. So, and again, remember, when you have something that is coded as preventative care, you're not going to see a copay. So keep that in mind. And again, or use the clinic and you won't have a copay at all. I mean, use the GHC clinic here on campus is what I meant to say. So how do we compare when it comes to contributions? We have about either a 7 or 8% employee contribution. On average, the Wisconsin Technical College System pays about 10% or more. State of Wisconsin's at 12%, I believe. GHC book of business anywhere between 8.6 and 17% employee contribution. WPS 12.6 and 15.8. So happy to say we are still well below those. Public sector, you're going to see again, lower 10% single, 11% family than you will on the private sector, which has always been higher right now, and probably to continue. We received or use this data from the M3 Health Insurance Market Study, so that's where we're getting this information. So we have put all of the plan details online, and you can get that now behind the faculty staff fac staff page on the intranet. So take a look at there and look for that umbrella. So another change this year, we've in the past we've always said, oh, if you're not going to make any changes, you don't have to do anything. Well, this year you do. We are doing open enrollment in Workday, just like we did with Vision and Flex last fall. So now you'll need to go through, and even if you aren't making any changes, just confirm your coverage. And it's kind of cool to see everything that you have. And if you have questions or anything you need to update, it's a great time to do it. So you will see something in your Workday inbox to take care of starting on June 1st. So don't look for it earlier than that. Then the deadline to do this is June 23rd. So we have enrollment from June 1st through June 23rd. But don't look for it on May 30th or May 31st because you probably won't see it yet. So questions regarding if you need help with Workday in general, call the help desk. And any benefit plan questions, contact our general HR number, or send a question to our HR mailbox, and our HR friends here will make sure the questions get to the right people. There's several of us that can help, but that way we can at least centralize the questions. So if you could do that, that would be really helpful. And I shouldn't have gone forward. So if you have anything else that you need, we'll also be talking about the basics, co-insurance, co-pays, and maybe you've already watched that. But those of you who haven't, that kind of gives a nice, just basic education on what all these terms are. So hopefully that will be helpful to you as well. So thanks, everybody, and thanks for listening to me, and have a good day.